Hi everyone, welcome back. My name is Hina Mazarudin and I am your Vice President for PAs in Virtual Medicine and Telemedicine. Today I'd like to continue a series that mirrors and complements our educational webinars that we do for our PA students so that we can share and shed some light on real life examples of how PAs utilize telemedicine in their respective fields. I'd also like to use this opportunity to highlight our amazing members and to serve as an introduction or a networking opportunity so that we can build and connect together. You know that I believe we are stronger together. So without further ado, let's get started. Hi everyone, welcome back. I'm so excited for you to join me today and learn more about how a surgical PA uses telemedicine. Let me introduce you to Samantha. Hi Samantha, how are you?
Hi, Hina. Thanks for having me. I'm so excited to be here and to share my experience because it was an experience that I never expected to come across and was a first in my career.
Oh my gosh, that's absolutely amazing. So I'm super excited to learn from you. Let's start off by just kind of introducing yourself. Tell us your name, how long you've been a PA for, what area of medicine you work in, please.
Yep. So my name is Samantha Buhler, just like the movie Ferris Bueller's Day Off, if you've ever seen it. I have been APA for 15 years now, and the area of medicine that I practice telehealth in was in bariatric surgery. And you might be saying, is that even possible? It's surgery. You have to see the patient physically, don't you, to perform surgery? Yes, we did. So when I interviewed for this job, they told me that it was going to be 100% virtual. And I thought, there is absolutely no way you're going to accomplish this. What do you mean? So, our setup was that the patient was going to be seen preoperatively, 100% virtually. We would see them the day of surgery, perform the surgery. Of course, we cannot do that through telehealth. And then all post op care was going to be 100% virtual. I thought, this is not how I've been doing it for the last decade, but I'll give it a go. I had some great leadership, some great surgeons who had already been doing this, and actually it worked out really great and patients loved it. Um, so we found, especially where we were practicing at in an urban location, this was in Orlando, Florida, traffic is a barrier. Somebody doesn't have a means of transportation. We wanted to make sure that we were providing access to care to anybody who wanted it. So obesity care, it takes a lot for somebody to come and ask for help. So sometimes they don't want to be seen out in public or they have, body shame. So we wanted to make sure that they felt comfortable wherever they were going to be seen. So patients really appreciated that. So we would start the pre-op process. We would give them their checklist, everything that they needed to complete before surgery. The patient could complete that on their own time. They would have information sessions with us. Those were also virtual as well too. And then they would actually meet us the day of surgery for the first time, which was absolutely crazy to me that patients were willing to put all of their trust and respect in us. And we were able to build that connection leading up to surgery enough that they would trust their lives with us, essentially. And then after surgery, once they were discharged from home, they saw all of our post-op visits with us as well virtually. And it went really well. We did have an option if there would ever be some sort of an emergency. We did have some physical office space if there was any cases where we would have to bring somebody in for a wound check or if we had to pull a drain at some point or another. But that was very few and far in between. So I can say we were 99% virtual.
That's absolutely amazing and very thoughtful of, like you said, kind of putting yourself into the patient's point of view and perhaps what their concerns may be, and really meeting them kind of where they're at to get that information and to help them out. I do have a follow-up question for you, please.
Sure.
So as far as like kind of physical exam, getting vitals, getting pre-op clearance, and even like post-op, how does that work on a virtual platform?
So if a patient had the availability to be able to take their blood pressure or temperature, they could self-report that. They also self-reported their scales or their weights. I do know some programs that would send a scale to the patient's home. There's Bluetooth connectivity, so that's something that you could consider as well too. For our current weight loss clinic, we're sending both a scale and a blood pressure cuff to the home so that they can monitor that. So those are options as well too, if your program can provide those. If not, the patient could self-report them to us. Now, as far as any pre-op imaging and labs, of course, they would have to go get their ultrasound if they needed an EGD in person. So a lot of that still required them to be coming in person to, because there's just no way around it. You can't do an EGD at home. You can't do a chest X-ray at home or lab work at home. So they would still have to come in for that. But all of their visits with us were 100% virtual.
That's absolutely amazing. So you're right. It's kind of almost like the perfect blend of a hybrid where you're doing most of your like clinical part as far as like getting your history, taking all that, and but still using having the patient come in to, certain things that just can't be done virtually, at least yet. Maybe as technology progresses, we may have more options in the future. But as of right now, you're right. To kind of utilize that hybrid kind of model and take care of patients. That's fantastic. Thank you for sharing that. Can you please share with us what you like about telemedicine and what you find to be challenging, please?
Yes, absolutely. So there's pros and cons to doing everything in life. I would say the best thing about telemedicine is that you're right, we can meet the patient wherever they're at. A lot of people do not have the luxury of being able to take off time from work. Losing a shift could be the difference of paying rent for that month or their groceries that month. So they simply cannot take time off of work or they don't have a means of transportation. So we don't want to exclude those patients from being able to get this care. Um, that's what I love the most about it is that we can literally meet with a patient anywhere, whether it's in their car, in the groceries, on the in the grocery store parking lot, or on their break at work. They can duck into a hallway. I mean, everyone has a phone now, so they can just connect on their phone. So literally, they can meet with us anywhere that they feel comfortable. What I do find the biggest barrier for me coming from practicing 100%, in person for 10 years prior to this was trying to build a patient rapport. So sometimes we can't feel that human touch as much through a screen as we can in person. So the biggest obstacle for me personally was trying to figure out a way that I can connect with my patient that felt meaningful, that still fulfilled me as a provider.
Yeah, thank you for sharing that. And it must have been quite the transition for you as well. Like you mentioned, you were doing this for so many years before in person and then went kind of the full other end of the spectrum, going, going virtual. And that must have been a learning curve for you as well, huh?
It certainly was. I mean, at first I was very hesitant. I was unsure about it, but I entrusted my leaders who and my medical director who had already been doing this and, proved the concept could work. So I entrusted them. They gave me a lot of support, a lot of guidance. And as time went on, I found how very convenient it was for us to be able to do this and how convenient it was for our patients and that we could potentially see anybody and everybody within our, license scope that wanted to see us for our care.
Absolutely. What a wonderful way to remove barriers. Thank you.
Mhm.
I do have a last final question, please. If you could share a message or a clinical pearl of wisdom for our PAs or PA students, what would that be, please?
My piece of advice is to never stop being curious. If it wasn't for me thinking, could this actually be done? Are you sure about that? I never would have had the opportunity if I would have been stuck in my ways and said, no, this is too advanced for me. And I don't think that this could happen. Then I would never would have been afforded the opportunity. And this is anything in life, even learning something new in medicine. Always be curious because that's how we make innovations. That's how we make advancements in medicine is always asking, is there a better way to do this? So never stop being curious.
Perfect. Thank you so much. And thank you all for joining us. We appreciate it. We'll see you on the next one. Bye, everyone.